Hi, bro. Hi, Dr. Gaurang. Namaste.
Hello, Carlos. Hello, everyone. Bom dia to all Brazilian friends and como você está?
Cada vez melhor português.
Yes, I'm
So,
I'm learning a few words.
yeah, yeah. You are better and better.
Deus te
Namaste,
abençoe.
namaste.
Deus te abençoe.
Yeah. When are you coming? When you
I'm
expect to?
coming. I'm coming. I think I'm coming on 15th. I think 5th. I will check the flight. I think I'm reaching on one day before.
Great, great. Yeah, anxious
Yeah.
to see you. So wonderful. Thank you so much for a step to come and to give us this third lecture session about
Of course.
results because it's a huge content, right? We have so many things to
So many
learn
topics.
about this. Yes, it's you in your book. Ah, by the way, we have to talk about your book, right?
Yeah.
It's wonderful, and you are speaking not only 12 results but 13. Yeah,
Sure.
so we can stay like for hours and hours speaking about this, and I know you have so many cases. So, wonderful.
So many. So many. And I sent you the first copy of the book and it's going to be published and it's going to be released in Recife with all of you guys, and we are very excited.
Yes. Então, pessoal, por favor, mudem a interpretação para o português, né? Para conseguir ouvir a
So
tradução
Carlos is just telling everyone how to set the interpretation mode.
Hello,
Muito
Marcelo.
Hi, Gaurang. Good to
É
see
um
you.
prazer termos as pessoas aqui com a gente hoje, nesse domingo, para aprender. Bom dia, Marcelo. Bom dia. Espero que você esteja bem também. Obrigado pela tradução. E a gente hoje vai ter várias coisas, né? Nós faríamos essa terceira sessão, né? Sobre
Carlos is saying that
ainda
after
resultados,
your session on Schuessler salts,
realmente
we will make a session on how to use
fantástico,
the
Yeah,
onde
new Viva
poucos conhecem Sais
this
de
is very
Schuessler,
good.
system.
como o Dr.
Hmm.
Gaurang. É um tema que ele domina como poucos
So Carlos is
homeopatas
saying
no
that
mundo,
we
porque
will
ele
have
usa
now
realmente
your
essa
third
metodologia.
presentation on tissue
Poucos
salts
homeopatas
that
conhecem o Sais
you
de Schuessler,
probably are
e
one of the
realmente
homeopaths that use the
ele
most the
vai
tissue salts,
fazer
so
um
you have the
desafio
most
para a gente
experience to share with
falar um pouquinho
us,
sobre o Sais de Schuessler.
and you will launch the
É um
book
prazer
here in
termos
Brazil
colegas com a gente
Sure, with pleasure.
next month.
e a gente, além desse, vamos ter
Excited to meet
Mhm.
you. I hope you're coming, Marcelo.
Mhm.
nós vamos ter 1 hora e meia de
So
sessão, né, com o Dr. Gaurang, e depois a gente também vai apresentar algumas novidades. A gente está
Carlos is
planejando uma
saying,
live
yeah,
para
again,
apresentar alguns
the
módulos
schedule for the
novos que o pessoal
morning.
está pedindo para ver, e a gente vai. Então fiquem um pouquinho mais, vai ser meia
um,
horinha a mais. A
that will
gente
be
vai, eu acho
just
que todos vão
after
se
you
divertir
finish.
muito com isso que vai ser mostrado, porque é um futuro da homeopatia, né? Os softwares, a inteligência artificial são o futuro da homeopatia. A gente vai mostrar um pouco da aplicação dessa inteligência artificial, o Marcelo, eu, no dia a dia do homeopata. So, my brother, thank you so much. Dr. Gaurang é uma referência mundial, né? Não só em Sais e Schuessler, ele vai estar com a gente aqui no seminário. Então, aqueles entre nós que não o conhecem, ele é um professor, hoje um conferencista mundialmente aclamado, tem feito seminários na França, na Holanda, na Alemanha, no Japão. Esses tantos lugares que ele tem visitado que eu nem sei todos.
So Carlos is doing
Estudou
a
com
brief
grandes
presentation telling
homeopatas
that the different
e a gente
countries
viu
that you have
aí
visited
nessa
to give
juventude
your
dele, hoje é um
lectures.
dos professores mais
Yeah.
chamados para falas em seminários. Então é um prazer a gente ter, e agora brasileiríssimo, né? Casado com a doutora Catarina, brasileira,
And that you
e
are
tivemos
now more than
participações
half
incríveis.
Brazilian
Então
because you
é
are
um
married
prazer
to
muito grande mostrar esse
Brazilian
momento
wife,
eu do Dr.
and
Gaurang
it's
entre nós. So thank you
very
so
good to
much, my
have you.
brother. Thank you for coming again, for teachers, and we know how deep you used to go in this when you are speaking and showing your cases. Thank you so much.
Sure, sure. Should I start?
Yes, please.
Okay, okay. Thank you. Thank you, Carlos, and always a pleasure to meet all of you. It just feels like coming to home every time I am with all of you, or every time I am um, with Carlos or Marcelo or each and every one of you. So, well, namaste, and very excited to be there. But today's talk, I divided into two parts. Um, of course, one part will be on tissue salts, but I thought that I should also tell you all the things that we are going to talk about in the whole seminar. Why this seminar is very exciting for me, because I'm coming there almost after, if I'm not wrong, more than 2.5 years or something like that. And in the last 2.5 years, I've been working a lot on a lot of newer remedies, a lot of lesser known remedies. And one of the group of remedies that I've been working a lot with, which I want to introduce to you, is the group of remedies called as the matrimonial remedies. This is a very, very important group of remedies in today's times. Matrimonial remedies are remedies which are gifts of mother, which come from the gifts of mother. What are these remedies and how to use them? Which are the remedies which you can think about mainly in matrimonial remedies? Remedy like placenta, remedy like vernix caseosa, amniotic fluid, oxytocin, colostrum, lac maternum. So we have this really, really amazing group of remedies which I'm using a lot, and especially in women's health. And even if you're treating many pediatric cases, many cases of autism, ADHD, it is remarkable. So I'm going to just, because I want to share with you the latest experiences, the latest advancements in homeopathy with all my Brazilian friends, because with God's grace and with the friendship with all of you, and especially with the support of my partner, uh, we've been able to understand a lot of newer remedies. And I've been traveling the entire different countries to share these experience. We are going to now talk about matrimonial remedies. So when do you use matrimonial remedies? Especially in cases where, especially one of the important theme is when there is a big transition, big change in their life. Suddenly after pregnancy, there is depression. Suddenly after delivery, there is a convulsion. Suddenly after a big change in their life, there is a big impact in their life, and then they become very, very depressed or sad or develop certain mental health related issues. Never well since certain hormonal changes like death, like miscarriages, like abortion. Patient tells you, doctor, I had an abortion so many years back, and after that, I have never been the same. History of too much of IVF treatment, which didn't work. Ever since then, I have developed this eczema. Since then, I've developed this problem. History of hormonal treatments. Too much of estrogen or progesterone taken. This could also, patient may need matrimonial remedy. They often look a little bit like row 2. So many of the patients where you're thinking about row 2 remedies like carbon, lithium, boron, all the entire row 2 remedies, or remedies like the Ranunculaceae family. Many of them may look like matrimonial remedies. So patients who require this remedy may often say, I feel as if I need a lot of protection and covering. Here they may remind you a little bit about mollusk remedies also. But remember, these are finally sarcodes. One of the things that you see in them is that they are very spacey, very dreamy, little absent-minded, little floating, They are not totally very, very stable. They are a little bit airy, little bit, their talk also is a little bit in air, little bit, One of their other experiences is constant conflict between grounded and ungrounded. There's a lot of state of confusion, disorientation, forgetfulness, suppressed feeling. Here they remind you a little bit of Nux moscata family, the magnolia family. One of other experiences to retreat and withdraw from the situation, a big situation, and then they want to retreat and withdraw. They may look very immature, undeveloped, and there's a need to transform in them. There's a feeling that I want to transform. They can also look very dependent and clingy and extremely attached. And we have some absolutely amazing set of matrimonial remedies. Remedies like prepared from, just to give you a little idea. Placenta, we have a homeopathic remedy prepared from placenta. And there has been a lot of provings done. A lot of provings done by Alice Timmerman and people like that. This is one of the remedy, placenta. We have a remedy prepared for them. By the way, this is a remarkable remedy for autistic children. I use a lot of this remedy, placenta. Another remedy which I use a lot is umbilical cord. Remarkable remedy. Okay. I recently gave umbilical cord to a lady, a 60-year-old lady, and she was in depression. She had vitiligo spots all over the body. Her main feeling was that her son, who's a 40-year-old man, she's very attached to her, and that's why she's creating a lot of problem in his life. And she wants to detach from him, but she can't because there is a feeling of lot of attachment with him. So there's a feeling that I am attached, I want to detach, but I can't. So umbilical cord at this state. Again, lot of work has been done. David Riley, Melissa Asylum. Provings of these remedies are there close to more than 20 years. So these are all very, very well-known remedy. Another remedy we have is amniotic fluid. We have remedy prepared from amniotic fluid. Polyhydramnios, oligohydramnios. Many of these cases we use these remedies. Amniotic fluid. I'm just introducing this to you. Of course, we are going to talk a lot about this in the webinar, in the seminar, in Recife. My idea today is just to introduce to you because I'm going to bring to Recife a lot of newer ideas, newer cases, pathological cases, newer remedies you never thought before. And also a lot of older remedies, the tissue salt, the classical remedies. So a lot of old and new together. And I've been working day in and day out, 40 cases. I'm trying to study every single day of my life. And I've been collecting these cases to share with the profession about how we can help so many patients. We have a remedy from Vernix also. This remedy was brought by a great homeopath from Netherlands called as Steno Smits. And we are not talking about a recent remedy, has more than 27 years back that this remedy was proved in 1998. Vernix caseosa. So, well, we also have a remedy prepared from human milk with colostrum. Only human milk is lac humanum. Lac maternum is human milk with colostrum. Again done by Tino Smith, Patricia Hitherley. So a lot of newer experiences. I want to bring them to you. I'm going to very quickly share with you 2 or 3 cases. Different cases. Every case is different. Some newer remedies, some older remedies, but I just want to introduce them to you. Today's lecture is more like you can say, like a trailer. I won't be able to share everything with you in 1 hour, but it would be nice to know what are the things we are going to talk about. So let's see. This is a 30-year-old lady who came to me with anxiety and infertility. She took a lot of remedies in the past. Lithium carb, medorinum, calcarea carb, also folliculinum, uforinum. So she has taken a lot of remedies. She herself is a homeopath. And her investigation reports her estrogen is affected, her hormones are affected. And the doctors say that it's very difficult for her to conceive. But she wants to treat with homeopathy. She wants to take treatment from homeopathy. And I want to tell you, we have so many, you know, our clinic in Mumbai has become half a what you call as a infertility clinic or a women's clinic or gynecological clinic. Katarina, she sits with me in Mumbai in the clinic and I tell her, see, this is a homeopathic baby. This is a homeopathic baby, which means that this child is in this world thanks to homeopathic medicines. And the mothers come and they want to meet Katarina and they want to tell, thank you, because of you and your husband, you give the homeopathic remedy and now I have a baby. It's remarkable. So this is one of the cases. And I want to bring this cases to you. I want to show you how to do it case after case, case after case, case after case. So this particular lady, as I told you, case of infertility, she was not improving at all. Her main problem was she was putting on a lot of weight. She's very, very restless. Her menstrual problems are too much. And she's too much like a child, right? Too much like a child. She can't keep anything inside. She's very, very dependent, very, very clingy, very, very obsessed about cleanliness. And she's very fast paced, wants to do things very, very fast, wants to be busy, wants to be industrious. She can't keep quiet. And I studied her entire case. And it was a classic case. Okay, it was a very, very classic case of the remedy graphitis. That's what I found as her remedy. I'm going to summarize the case and not tell you so much in detail because we have limited time. So you can see that all the symptoms in her case, her main symptom was anxiety about trifles. Smallest thing would affect her. Very, very irresolute. Smallest thing, she would cry and she would call up the husband and she would say something. Until she doesn't express what she feels, she will not calm down. But the problem was she had already taken a lot of carbon remedies without any change. And that's why I knew that in her case, this is the approach that I wanted to use. I'm just showing this to you. In many cases, and there are many complex cases in today's times, in many cases, you need to remove the block. You need to give a remedy to remove the block. And very often, this removal of block could be by a sarcode, by a nosode, or by a bowel nosode. And then the deeper indicated remedy. So now the question is, which is the blockbuster in this case? Which is the remedy to remove the block? Which is the remedy to remove the block? Which could be a sarcode. Sarcodes are remedies which are prepared from healthy human tissues. So the sarcode of choice in this case, and remember when all sarcodes are given, and all sarcode fails, because in this case she has taken folliculinum, thyroidinum. Remember the king of sarcodes. Which is the king of sarcodes? You can see here. The king of sarcode is pituitary gland. The biggest and the most important kind of gland that is like the president of the country, is like the prime minister of the country. And that's what was the remedy I gave to remove the block. A remedy prepared from pituitary gland whole. Remember, there are 3 types of pituitary gland. But I gave her pituitary gland whole. Okay. I'm going to first tell you what are the 3 types of pituitary gland. You should know this. Okay. What are the 3 different types of pituitary gland? The first type of pituitary gland, we have 3 pituitary glands in homeopathy. The first is prepared from whole, pituitary gland whole. I give this remedy when there are too many hormonal diseases, too many endocrine diseases, and there is a lot of endocrine diseases, like the patient has thyroid problem, has PCOD, has diabetes, is obesity. So when there are many, many different endocrine disorders, then you need the king of endocrine, that is pituitary gland hold, and especially lack of reaction. When all endocrine remedies are given and there is a lack of reaction, pituitary gland. Another pituitary gland, which is the anterior pituitary gland. This is a very important sarcode also. I use it typically in cases of autoimmune thyroid disorders. This is the fantastic remedy for autoimmune thyroid and thyroid conditions. And finally, remedy prepared from posterior pituitary, as you know, the anatomy of pituitary. This is very important for post-pregnancy related disorders, and it has symptoms like sepia. So it has a lot of butterfly-like skin like sepia, a lot of gynecological symptoms like sepia. It's also very important for nocturnal enuresis like vasopressin. Yeah. So it's a remarkable, this three remedies are quite remarkable. Okay. But what is the indications of pituitary gland hole? I wanted to tell you, especially when there are a lot of hormonal. So sometimes you see this patient, there are many problems. There is obesity, there is PCOD, there is thyroid, there is pancreatic disorders, there is liver disorders, there is Cushing disorder, many endocrine disorders. That is often, for me, the first indication for pituitary gland. And the second often is lack of reaction. Lack of reaction to many remedies and many sarcodes. And goes without saying that there are many more indications of pituitary gland also, which I have told you before. One of the very important is very suddenly high blood pressure. When there is a sudden high blood pressure, or when there is a sudden spasm, isn't it? If there is a sudden cerebrovascular stroke, sudden spasm of the artery, sudden angina, spasm of anything is a keynote. Congestive headaches, even renal colics. There are clots in the brain, you want to absorb it, pituitary gland. It's such a big remedy. My friends Valeska and my other colleague friend Iso, and also my another friend helped me to translate the book Materia Medica of Sarcode and Nosode in Brazilian Portuguese. So some of you have that book. So what did I do in this case? I gave pituitary gland 30, followed by pituitary gland 200, and after that gave the indicated remedy, that is the graphitis. So you can see now this is one of the latest work that I'm doing, where in very complicated cases when many remedies are given without change, you give a remedy, wait for its action, and then give the deeper remedy, right, to open the block. And we followed up regularly. We followed up regularly for a few months. We followed up with the same remedy, and within the 3 months we were able to see that she was able to have the urine test positive, and the pregnancy went very well. And well, she delivered a very healthy human baby, of course, and the child is totally healthy. Totally healthy. There were certain minor issues during pregnancy, like nausea during pregnancy. We gave her lacticum acidum, that helped during that time also. So it's very important, I always mention this, to treat during the pregnancy also with help of homeopathy. And it was remarkable with this. But this is not the end. Now another problem. After the delivery, the mother was not able to breastfeed. What to do? Now the mother is in depression. Now she's not in a good health. She's become very emotional. She's become very anxious. She cannot decide anything. She's become very indecisive. The child is supposed to get vaccine. The mother actually is a homeopath. And she's worried, don't give vaccine, don't give vaccine. She's getting very emotional. She's not able to have control, getting extremely emotional, crying, screaming, totally depressed, putting on more weight, not able to lactate. So post-pregnancy, psychological, mental health related issues, where she's becoming very emotional, very sensitive. She's constantly feeling guilty now. My God, I'm not able to breastfeed. I'm getting panic attacks. I feel now I need my mother. I want my mother. And she's crying and screaming and calling doctors, including us, do something. I want my mother. I feel attachment with my mother. I feel attachment with the child. I'm not able to take care of the child. So you see, this is an entire state of what? This is an entire state of, yes, you're right. This is an entire state of what we discussed today. This is an entire state of matrimonial remedies. This is the state of matrimonial remedy where the especially mothers after the pregnancy, during the pregnancy, after the delivery, typically when they are mentally traumatized, when the child is born, when there is a detachment from the child, and they behave like a child, they go in a psychosis. They are sensitive to this change, this transition. They become confused, they become disoriented, they are not able to understand, decide, and their mental health gets affected. And we have this list of about 7 or 8 important matrimonial remedy. Now the question, and I'm going to teach every matrimonial remedy in detail when I meet you. Now the question, which matrimonial remedy to give? And the matrimonial remedy that I gave, I will want to tell you today about it, is a remedy prepared from the Vernix caseosa. We all know Vernix caseosa. Vernix caseosa is this cheesy, fatty layer that is produced by the mother. It's very, very interesting. When I was studying about this, and I'm doing a lot of work on matrimonial remedies nowadays, and many of these kind of deeper remedies for today's time, these are remedies of modern times. Human is the only animal in the world that produces Vernix caseosa. It's quite fascinating, no? That no other animal can produce Vernix caseosa the way a human can. Why? Because it protects the womb and the baby with irritation, infection, etc., etc., etc. So it's like a protective layer. And this is the materia medica of Vernix caseosa. What is the materia medica? The materia medica is that is the main idea. The main feeling of Vernix caseosa is the feeling of ranunculacy, of pulsatilla. The feeling is as if no skin, as if has no layer, as if he is very, 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 very sensitive, oversensitive, as if anything that happens attacks them, as if anything that happens far away, they can feel. There is a feeling of need to be protected, need to be secured, and there is a feeling of being very, very oversensitive. Smallest thing and they will start crying, smallest thing and they feel. If the husband is in a pain, she will feel the pain. So there is a lot of sympathetic kind of state. Melissa Asylum, who brought these remedies, has a very important symptom that she gives about Vernix caseosa, is that the feeling of being unprotected and assaulted, even with poison, with a lot of fear remaining, a lot of feeling of overwhelmed state, a lot of feeling as if there is no barrier between them and the world. So what Vernix caseosa actually does, as Stinu Smith says, is it enables us to stay in contact with outer world on all levels without being overwhelmed by it. And also to become aware about your own feelings and others' feeling, and making sure that others' feelings are separate and your feelings are separate, and there is a wall between them. Because in the disease state of Vernix caseosa, there is no wall between yourself and others. So that's what I gave Vernix caseosa, and with the help of that, the lactation improved, her health improved, and well, the child's health also improved, and she remained in a very, very good state even now. So this is a little bit of a very, very exciting and interesting case with this group of remedies that I wanted to share with you today. Are you all with me? Hello. And are you getting a little idea about this group of remedies that we are talking about today? Carlos, is these remedies very common in Brazil also? Do we use them a lot? Not so much.
Not at all. unfortunately, we know very few about, especially you
That-
show
hmm.
Vertex Casiosa right now.
Yeah, because
I
it's
I
these
never
remedies.
saw. I have
Yeah,
never
these
seen.
remedies are very popular all over the world. Many European, American, many homeopaths are using with very, very good results. In fact, I've written a little bit about it in my new
Yeah,
book.
I remember a situation where in one seminar, Dr. Sankaran told us about Vernix caseosa. In one
Mm.
case, that was a differential remedy for that case, but I saw some cases in paper, but if, for
We will
to be
talk about it.
honest,
And what I will do is that I'm going to get these remedies from India for all of you. So I'm going to get a small box with this remedy in 30 potency, and I'll give it to my friend Carlos, and then he will give it to maybe a pharmacy or something, so that this
yeah.
important remedies will be available for everyone.
Yeah,
Maybe.
for sure. Hormones and placenta, this is not common, but we can see cases of pituitaria, especially after
Sure, sure.
one your book and a seminar from Dr. Jayesh about sarcodes. But matrimonial remedies is something very, very interesting
Yes,
because
yes. And
very
very,
few
very interesting.
persons,
Very interesting. Very
yeah,
interesting. I use it a
like
lot. This Vernix looks,
umbilical
Vernix
cord, very few.
caseosa, yes, Vernix caseosa looks exactly like ranunculus. So if you are,
Yeah.
thinking about ranunculus, you have a differential diagnosis that, okay, with the state of matridonial state that we discussed about, we could think about this. Umbilical cord has this state that reminds you of oxygen and nitrogen. So these are
Yeah,
very fabulous remedies to think about.
Dr. Amarilis she's a very important pharmacist here in Brazil. She's saying that
Okay,
we do have uh, these remedies available here, but we don't remember, on these
understood.
remedies. Do you use this remedy like single remedy or with another remedies like
So
different?
it depends on the case. Like in this case, we were treating layer by layer, and as symptoms came, we gave. I also have cases where I've given only that throughout. I also have cases where I've used that, and after few years, after few months, required another remedy. So it's just like any other remedy, but these remedies are especially effective in many cases of children. Very, very important remedy. I will present some work on placenta also. Children's cases, autistic children. Placenta looks like saccharum. They are very, very restless, very, very abusive on one side and very clingy on another side. So, and also in mother's health, post delivery, so if you're treating gynecological cases, they are really, really quite fascinating. And because Amaryllis is here, I also want to ask her that whether we have the remedy 5-fos in Brazil, because it will be so useful. Amaryllis.
And what is wonderful is that we are speaking. That it would be great and very interesting that you bring your cases on matrimonial remedies for our seminar here in Brazil. So we will have you will speak a little bit more about matrimonial
Of
remedies
course, we will
and
talk.
maybe some cases about this in seminar, right?
Yes, yes, we will talk. We will talk about this cases also. We are going to talk about so many cases. And now we come to the second part. And of course, that is about the tissue salt and classical homeopathy. And of course, because this is such an important topic, and the only reason for this seminar, only for the Brazilian colleagues, we have created this book. This book is now in the printing machine. The printer is making this book, Schuessler tissue salt in classical homeopathic practice. And well, it is in detail. It is in absolute detail. You will see it's totally in detail. It's a very small book. It's only 120 pages book. I wanted to make like a very small book. And as promised, there is also a very nice repertory here. As I told you, for every pathology, what could be the important kind of group of remedies, like dandruff, very common dandruff. I use a lot of calimure 6x or natramure 6x. So many things like that. So let's come to the case. I'm going to very quickly show you a couple of cases, very interesting cases. I'm going to show you 2 cases of avascular necrosis of the bone. Okay. Simple cases. I'm going to try to summarize it for you because I also want to keep the last few minutes for again telling you about each and everything that I'm talking you. I'm summarizing it for you. But the real beauty of it is where I'm going to bring almost 20, 25 very complicated cases with with interesting prescriptions, some new, some old in the Recife seminar. And each one of you who has joined here, I want you to come to our Recife seminar. And if you can't come, at least join online, because there is a possibility, which Carlos will also talk about, that people can join online. If you can't come, if you find it difficult to travel, sometimes you can even join online. And even if you can't join online, if you can't come on that day, you can watch the recordings later, because these are the latest advancements. And I want to make sure that you are also kind of growing with homeopathy. As homeopathy is growing all over the world, it's very important for you to be up to date with the latest advances, like these remedies, matrimonial remedies. You want to know them in detail, because you need to know these remedies and many other. I'm going to talk to you about so many other advances that have happened in the last 3-4 years. So yes, before I talk about the case, I would really, really like that each one of you can join online. I think, Carlos, people can join online and they will get a access to watch the recordings later. Suppose they can't join, they can join
Absolutely.
after 1 month. They can see the recording.
Absolutely. For 6 months, seminar will be available for people who join online,
Exactly.
because it's hybrid event, right? Então, I will speak this in Portuguese for people. I think Marcelo
Yes.
is translating, but o que o Gaurang está falando é que o seminário é híbrido. Então, ele está trazendo para nós uma experiência que é
So
única.
Carlos just explaining that it will be a hybrid
É uma
format.
coisa que ele leu, é uma coisa que ele
It's not something that he reads about, it's something in his practice of everyday life practice,
vendo os mestres,
some unique work that he does
trabalhando.
doesn't have learned also with some really great people like Dr. Shankar and Dr. Sharkar. And I asked him to bring this experience on Schuessler salts because he has his deep knowledge of the remedies with classical homeopathy, but he really does a classic homeopathy as few. And I asked him to bring this knowledge that have been lost. And just few teachers today in Brazil could talk about these tissue salts, and he will bring the book. But if you could not join in Recife, there's a very nice group already aligning, but you can join online and be able to get to know Schuessler salts and practice. I've been using, and it's very nice. So I'm very grateful for him. So, and we have this mission to bring this knowledge that is so unique, so particular.
Thank you so much, Gaurang. Thank you again for bringing
Thanks.
this acknowledgement for us. And this book, especially.
Sure, sure. Okay, let me quickly go through the case and we'll discuss a little bit. So this is a case of avascular necrosis of the hip in a 37-year-old gentleman. And most importantly, I have given him a remedy, calcarea floor, without much change. And previously also Staphysagra he took without much change. So what I'm also going to bring across are cases where the traditional approach hasn't helped. The constitutional remedy hasn't helped. So this is a case where we have been struggling for almost 4-5 months without any change. Now what to do? And he's in a lot of pain, vascular necrosis of the bone, how painful it is. So it's 3rd grade, the symptomatology. Okay. How did it start? COVID vaccine. He took COVID vaccine. He took 2 booster doses of it. I think you all know the side effects of vaccinations. I don't have to explain you about it and how common it is after vaccination. Avascular necrosis of the hip is very, very common in Europe, in India, in the US. I don't know how it is in Brazil, but after vaccinations, the hip replacement have improved, has increased a lot in India and in some parts of Europe. Maybe some of you may know more about how the vaccination effect COVID vaccination effect on the bones happened in Brazil. Maybe someone can share a little later also. Yeah. I think it must have been quite bad in Brazil also, I'm sure.
Yes, very bad.
Yes.
Thousands and thousands of cases.
Oh. So this particular gentleman, very, very bad situation. Pain, spasm, unable to walk. Yeah, I will show you a video of him where he is unable to even get up. Let me try to show you this video. Okay, I'm going to open this video. Let me try to show you this video. Okay. Unfortunately, okay. Let me try again. Okay, no problem. We will watch it again. Here we can watch it. Problem, yes.
डॉक्टर सर मैं चल भी नहीं पा रहा था, मैं रेंगते रेंगते जा.
So this is the gentleman. This is our patient. Okay. I have a video where, let me see if I can show you. He wasn't able to walk at all. Okay. Okay. No problem. I will show it to you at the end of the case. So I tried to study his case. And the first thing I saw was he was not interested in giving the case. First symptom. He said, "Why are you asking me so many questions?" He started laughing at me. And even my colleague who took the case before me, he told me that sir, he's not interested in giving the case. Do you think we should do this case? I said, of course, this is his main symptom, that he's not serious about his problems. We should give that. That is the main centrality of his case. If this is the way he's behaving with you. He said, yes, sir. We are asking that what is the type of pain, and he's not taking us seriously. He's not taking homeopathy seriously. He's not taking his disease seriously. And because you are going to learn a lot of repertory with Carlos and Marcelo very soon. Very important in repertory is also to learn conversion of patient language to rubric. Very important. That is the main thing. This is what I learned from Praful Vijaykar, the great man. Praful Vijaykar from India. I think most of you may know about him. The master of predictive homeopathy. And I had a great fortune of spending few days with him in his clinic, even him treating very complicated cases. And I saw his main thing was, Carlos's main thing was, he was a master of converting patient language to rubric. Anything he observed, he was able to know how to take this in repertory. This was his main game. He was so good at it. So good. Probably the best I saw. Of course, Dr. Sankaran is equally there. But something about Dr. Praful Vijaykar was he was very intuitive. Intuitive, like he used to, feel. He used to feel like some things that patient can't say. This was his specialty. And that's what I learned from him. So about this person, when our patient is behaving in this way, how to see this in repertory, this is also important. So let's open the repertory. There are so many different types of repertory. I'm going to now open complete repertory. The first rubric that I took for him was, of course, you know this rubric, buoyancy. What is buoyancy? Buoyancy means light. Yes, very light. Means someone who doesn't take things very seriously. Very light. So this is the first symptom of the case. So I'm going to show you step by step in the repertory. This is how you do it. So my first rubric is this. The second rubric, now here I'm going to use a little bit of materia medica and reference work. I use necrosis of the bone. I put it in the reference work. Okay. I open necrosis of the bone in the reference work. And when I put that, you can see I can take this caries of the long bone, right? Or I can even take necrosis of the femur. I can take both the rubrics. I hope you can see this, right? So sometimes with the repertory, you can also, if you don't know certain rubric, you can put it in the reference work. This is also very artistically you can do. So these are some latest advances that you can use the repertory. Huh? And he wasn't able to walk. He was limping. I asked him, and this is something I do a lot nowadays. I ask him, what is the main problem of your life? Tell me. This is a disease. Many people did vaccination. Why did you get it? Why did you get a avascular necrosis? Something at a deeper level. What is the trauma of your life? What is your sensitivity? Then he opened up. He told me. He said, sir, my main problem is my wife. I said, what about your wife? And he said, when I got these symptoms, when I was little sick, I saw that my wife doesn't respect me. And I think my main problem is sex. I said, what do you mean by sex? He said that I don't get sex with my wife. I want to have more sex. I don't get it. My wife leave me. I want to leave my wife and I want to have sex with many, many different people. This is the thing. I said, okay. What will you do if you get cured? What is the first thing you will do? He said, the first thing I will do if I get cured, because right now I can't even get up from the floor. I can't have sex because I'm on the floor. I can't walk, he says. But the first thing I will do, if you cure me, I will get married. In India, it is a way of thinking. Okay, maybe someone else in another country will say, I will go to a prostitute or I will go and have a girlfriend. But in India, it's more common in the village he comes from that if you need to get married. It's a cultural thing. So this was his main thing. His main thing is sex, 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 and more sex. So my next rubric was, I want to show you. Yes. Was, yes, amorous. And next rubric was extremely shameless. Yeah. He doesn't care at all. Now, when I look at all these rubrics, and yes, finally, one more very interesting rubric in his case, I want to show you. Very peculiar. His tongue had a big crack in the center. Okay. So I took the rubric. I want to show you mouth, crack of the tongue. You can see here. And especially, you can see this rubric. Right? Now, when you put this together, already you get only one remedy throughout, and you get the fluoric acid. Now I ask him more things and I confirm fluoric acid. There are many more confirmations for fluoric acid. Okay, including he's a very big alcoholic. He's a big smoker. He's extremely sexually oriented. His sexual desire is extreme. So what did I do? I gave him, I want to show you, fluoric acid 3200 1m with LM1, along with, for the pain, calcarea fluoricum. Why? Because fluorine is the same, and calcarea fluor, as you can see here, is the main tissue salt. If you ask me which is the main tissue salt for the bone necrosis, for avascular necrosis, it is calcarea fluor. So I'm going to very quickly show you this so that you will know the way I'm going to teach you in the seminar. I want you to know this. You can see here. I hope you can see this on the screen. I hope so. Yes. I'm going to show you very slowly, step by step. Okay. Yes. Calcarea fluor, chronic degeneration of the bone. The most important thing is genius is bone is affected, cartilage is affected, muscle is affected. Tissue affinity, induration, vascular issue. That's why it's very good for blood pressure also. Bone joints, periosteum, right? And the deficiency very often causes this pathology. Very often, calcarea fluor also works very well in 12x. I use it often in 12x. I have a case in Russia who had a tumor, cephalohematoma, that did very well on calcarea fluor. So this is the calcarea fluor. Some more things about calcarea fluor. You can see a lot of wrinkles. The teeth become very loose. Very important for cataract, very important for aneurysm, cracked skin, right? Swelling of the testes, uterine displacements, arthritis, very important for rheumatoid arthritis, and so on. I'm going to try to see if I can show you a very nice video of this patient. Maybe I have. Yes, I think I have it. Okay. Yeah, this is the video I was looking for. So have a look at this man. Before our treatment, I hope you can see this. Before our treatment, he wasn't able to walk. He wasn't able to get up. I hope you can all hear me and see me. Yes. Let's see this video. Have a look at this. See, he can't stand up. Can you imagine? Look at his gait. Unable to do anything at all. Let's see what he says about his follow-up. And we continued this. We continued fluoric acid and calcarea fluid for next 1 year. And he has done tremendously well. He has done absolutely tremendously well. We even stopped his medicine. And
तब तो सर मैं चल भी नहीं पा रहा था, मैं रेंगते रेंगते जाता
I'm
था.
asking him, how are you?
हाँ, और लेकिन अभी मैं वॉक करके जा सकता हूँ.
Okay, okay.
हाँ, मतलब मैं ये बोलता हूँ कि 80% तो मतलब.
He says previously I used to crawl. I was taking painkillers, it was not helping. But after taking fluoric acid and calcarea fluor as a tissue salt, because see, the tissue salts, as I discussed in our last talk, are very different to homeopathic medicines. And I don't give it together, I give it separately. After the fluoric acid, I give tissue salt. The tissue salts work at a very, very crude level. They are like supplements to deficiency of salt within. While homeopathic remedies are very, very deeper level. They are at a dynamic level. So it's almost as if they are working in a very different plane. So remember, both have a different role.
सर मैं मूवमेंट अच्छे से कर पा रहा हूँ. हाँ, वॉक करता हूँ सर.
He can walk now.
आप चल फिर पाते हैं?
हाँ हाँ, बिल्कुल बिल्कुल मैं
तो
चलता हूँ.
He even divorced his wife after fluoric acid for obvious reasons.
बहुत पेन होता था, वो कैसा है? थाई में पेन होता था, पीठ में बहुत दर्द होता था, वो कैसा है?
नहीं सर, अभी पेन नहीं होता.
100 में कितना कम है वो पेन?
100 में तो अभी 85% कम है.
He's saying he's more than 85% better.
मतलब मैं तो ये बोलता हूँ कि अभी कम से कम 4 महीने तो कम से कम हो गए.
He has stopped all allopathic medicine. Can you imagine? He was taking muscle relaxant, painkillers, everything that the orthopedic was. He has totally stopped it. Not one drop of it.
मैंने मसल रिलैक्स.
And I did this follow-up close to a year and a half back. He has stopped everything now.
आपका माइंड स्टेट पहले
How is your mind state? How is your fluoric acid state? I'm asking him.
आप बहुत आप बोलते थे बहुत सारी चीजें, वो अभी कैसे है पहले के मुकाबले?
बिल्कुल 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 नॉर्मल, बिल्कुल नॉर्मल हूँ सर.
यू आर इन अ हैप्पियर स्टेट.
बिल्कुल.
He's in a much better
रहता था
place. How is the sexual state?
ये रहता था, वो कैसा है?
हाँ, अभी
He says now it's under control.
जैसे मेरा हो जाता हो तो फिर से मैं मैरिज का
He
प्लान.
says I have divorced now. I'm going to get married again anytime.
हाँ.
And amazingly, he came to the clinic walking. He was crawling. This man was crawling. He came to the clinic walking. He's still limping, of course. Of course, he's still limping, but he can come walking. He's able to walk. He's able to move. And he's showing me, I showed him, tell me your movements, and he's able to walk. He even tried to show me running. Have a look at this. So, I mean, it's a very simple case. I know this, but such kind of miraculous cases, we can help so many patients with this kind of situation. Do you think I have time for one more case? Or we do question answer or both? As what do our friends say? What do our participants say? One more case or question and answer? One more.
More case. But we have one question here.
Sure. Go ahead.
Isabel is asking how often, if you were given calcarea fluor X 12X for 1 year every
No.
day, how did
So I
you
will
use
try
it?
to explain you. I will give you a broad answer. See, fluoric acid 200 LM2 I have given, let's say, for 10 days. Okay. Now, after that, I will give him calcarea fluor 12x. Day 4 pills once a day daily. First, I will give him for 21 days or few days, see how he is. As I told you, there is a very simple follow up in tissue salts. The patient should tell you that I felt better after taking tissue salt, then that means there is deficiency and you can continue it. But if the patient says, I didn't feel better, till that time you continue. So when they say that I didn't feel better, that means you totally stop it. It means that there is no deficiency. So in this case, I almost gave him for close to 8 months and then I had to stop because then he said that I'm feeling that I don't need this anymore. I'm not feeling the need for it. So he continued fluoric acid followed by calcarea fluor close to 7 to 8 months, Isabel.
Yeah, Gaurang, I could see that sometimes you use 6x, sometimes you use 3x, sometimes 12x. Why did you use
Yes.
12x this time?
So the two potencies classically are 6x and 12x. These two are the main potencies. 3x, I don't use it in Schuessler tissue salt, but I use it in another way. I may use it like I may give insulinum in 3x or iris versicolor in 3x if I want to give as organo specific. But right now we are talking about tissue salt. So the question is, when do we use 6x, when do we use 12x? So the answer to this is certain remedies work better in 6x, certain remedies work better in 12x. Also, if the intensity is very, very high, you give 12x. If the intensity comparatively is lower, you give 6x.
Yeah, but this is still homeopathic. There's no substance in 12x, by the way. So you told about this deficiency, but you use as an homeopathic
Yes, yes.
prescription,
Because
not substance.
because because it's not only if I can add one more thing, it's not only totally a supplement, but it's a homeopathic supplement. So there is a element of individualization there also. That's why we don't give uh, uh, any tissue salt to anyone, but you give it on a particular indication. So when you start with 6x and then you go to 12x and you want to give the indicated remedy. So if you're giving calcarea fluor, you want to make sure every indication of calcarea fluor is matched. I
Yeah.
think there
And
is.
so, for example, if you figure out that the the answer is good for 6x, for example, and then stop to answer to respond to this remedy, you use to enhance the potency to high
Yeah, I can give
dose.
12x after that. But generally, the patient should tell me that, I took this medicine, I was feeling better, but now I've stopped feeling better. Then when you'll go to 12x after that. Generally, most cases I will give 6x. But if the patient is in a lot of pain and the indications are good, like in this case, I use 12x, as you saw, because I had already given him calcarea fluor. If you saw that, I had given him calcarea fluor in the past. The indications were of calcarea fluor very nicely. So I thought that fluoric acid is indicated, but as a tissue salt, I will give calcarea fluor and it has indication. So it's a good idea to give 12x straight away because this man was struggling. He was in a very bad shape. So although sometimes in children's cases, just cough and cold, I might start with 6x. So the intensity you want to also evaluate.
Yeah, and if you, for example, one case where you could see that calcária fosfórica or calcária fluórica could be the deeper remedy. So
Yes.
for this case, for example, this is fluoric acid in this case, but if you get that no, it's calcária fluor is the deeper remedy, you give in X potency or you give in
It's a
only
very good question. Of course, my first choice is to.
I'm having exactly right now a case like this.
I will tell you. It's a very good question. So first of all, it depends on the type of case. I will first of all tell you it depends on the type of case. I don't use tissue salt in every case. No, it's not needed in every case. If there is a very clear indication for a homeopathic remedy, let's say calcarea floor is indicated very nicely, you give calcarea floor, you give it in homeopathic form. Okay, you give it in homeopathic form, let's say 30 potency. But even after giving the homeopathic part, it's not improving, and the patient has certain pathological condition like a lot of bone degeneration, okay, or a lot of cysts in the body, okay, or a lot of piles or hemorrhoids, which is not improving after the homeopathic potency, which means there is some kind of deficiency. Then I will add calcarea floor 6x, and I will, they say that take this along with this for 21 days. After you take calcarea floor 30 for 2 days, you start with this tissue salts and you tell me how you feel after this 21 days. So I would do that. So I have arrived to this not as the first thing, but especially in failure cases when patients are not improving. These are all strategies that we can use. So everything that you see, including the matrimonial remedies, including this, including, are all strategies to be used in failure cases. Very rarely you will give the first remedy as these, because we have beautiful remedies given by our masters that we can give constitutionally very nicely.
Great. Great.
Some
Let's
questions.
go for another case, please.
Let's do one more case, very small case, and then there are some questions that maybe Carlos and me we can both answer. So let's start with this one. Okay, it's a simple case but very interesting case. It's a case of a 42-year-old man who has avascular necrosis. Along with that, has a depression, and he's taking psychiatric medicines for it. Let's have a look at the MRI of the left hip. The MRI shows, you can see the avascular necrosis of the head on the grade 2 on the left side and grade 1 on the right side with joint effusion. You can see this. He's in a very bad shape. Let's see the video of the patient. Let's see if I can open it. I hope you can see this. This particular gentleman is using a walker. He's a homeopath. He's using a walker in extreme pain. Okay. So let's try to study the case. So, how did it happen? He had a fracture. During the fracture, he underwent a surgery. After the surgery, he was diagnosed with this avian situation, which was not improving. And he's now using walker with a lot of pain, lot of pain. And just like every case, you have to find. This is the secret of homeopathy. You have to individualize. Whatever it is, any pathology, cough, cold, cancer, avascular necrosis, you have to individualize the case. Just as Master Hahnemann has spoken in 153rd aphorism. Never forget this. I asked him, what is the thing about you? Tell me about yourself. What is it that is your biggest trauma? What is your individual kind of deep pattern? He says, I don't feel happy. I don't feel happy at all. I feel depressed. My whole career is destroyed. I was a doctor. I stopped going to work. I feel failure. I feel I'm not good enough. I'm nothing. My wife support me a lot, but I feel lost. I feel confused. I feel so bad I can't tell you. Okay. Tell me, how did this start? How did this pattern start? He said, when I was young, I was very pampered. I was very protected. People took a lot of care of me. I had a good boy image, but I was very shy. I was very timid. I used to like one girl. The girl insulted me. She humiliated me. Everyone, I used to go to college, everyone would laugh at me. They would keep laughing at me, joking at me all the time. I felt so humiliated. I felt as if I'm not good enough, as if I'm nothing. And I would cry. I started behaving like a child. I started behaving like a child. I used to be scared of going to meet people. If new people will come, I would get timid. I would get nervous. I would start trembling. I would start hiding. I would hide below the table. So I started behaving like a child after this trauma of humiliation and insult by this particular girl. This is my issue. Tell more about yourself. I get a lot of dreams. What dream? I get a lot of sexual dreams. I don't know, after this insult, everything, the sexuality is very, very high. I can't I can't stop the sexual drive. So very, very high sexuality. A lot of dreams of accident. Tell what else? I got a dream that someone is choking me and strangulating me. Someone is choking me a lot, strangulating me. So I studied his entire case. Okay. History of lot of masturbation. And what is the feeling in masturbation? He masturbate, and from childhood, okay? And then he feel very guilty. Thermally very, very hot patient. So it's a very, very interesting case. I asked him, tell me more about yourself. I'm very shy by nature. And from childhood, I'm very shy. I feel very bored. I feel I'm a donkey, he says. I feel like a donkey in my life. I feel not good enough. I feel I'm totally zero. All my decisions of my life are taken by my wife. I'm totally zero. I'm nothing. So I started studying his symptoms. He has a big inferiority complex, very, very big. And he constantly compares himself to others. Now, how do we analyze in this case? We are seeing a case here. I'm going to write it here for you. It's a case of avascular necrosis bone, right? So it's a very syphilitic state. And what is his deep feeling? His deep feeling is that he behaves like a child, like totally dependent for everything after the insult and humiliation of the girl. You remember that situation that happened? Very, very high sexuality, very childlike. Big masturbator, as you saw. So what remedy did I choose? I chose a very interesting remedy for him. I chose the remedy, the Baraita muriaticum. So on one side, the state of Baraita cup, which you can clearly see, the childish stage, the sensitivity to opinion of others, the strangers aggravate, the timidity, the feeling of being laughed at, the foolish behavior, the idiocracy. But Baraita cup doesn't have such a huge sexuality, doesn't have the feeling of humiliation by a girl, by a person whom you love. The person whom you love a lot humiliates you, insults you, laughs at you. This is muriaticum. And also muriaticum has this feeling of suffocation, a lot of suffocation that you can see in the dream. And that's why I choose. You can see this is called as a synthetic prescription. Maybe Carlos and Marcelo may show you today how to do synthetic prescription, how to use periodic table in repertory sheets. Very beautiful. If you know these kind of interesting things, they will show you this today in the lecture, hopefully. And many of these kind of things we are, of course, going to learn in the seminar also where we meet in Recife. And now you can see very nicely in Baraita, how to see Baraita Mure. Baraita Mure is the Baraita with very high sexuality. The Baraita which has the most highest sexual desire, it is Baraita Mure. Baraita like state of row 6 where childishness, unable to decide, and muriatic like state where disappointment. Muriaticum, the main feeling, you know, natrum mure, big disappointment in love, but muriaticum also has very, very high sexuality. And that's what I gave. I gave Baraita Mure 30. You can see here. Why 30? Because very pathological. I gave Baraita Mure 30, 2 times a day for 3 days, followed by 5-phos. 5-phos is a very important tissue salt as well. 5-phos is a mixture of all the 5 tissue salt, the calcarea phos, the natrum phos, the cali phos, the calcarea phos, etc. Everything together. This is a remedy which I use a lot where there is a lot of degeneration of bone, but also exhaustion. So his main symptom is extreme weakness. And you know that, for example, phosphorus, calcarea phos, the main, it's like a nerve tonic, and 5-phos is like a nerve tonic also. And that's what I gave. I continued this for the next 3 to 4 months, and then stopped 5-phos and only Baritamur for the next 1 year. And it's almost been more than a year now. I want to show you his latest video where he's able to walk totally on his own. We have stopped the homeopathic medicine. He has stopped the walker. He's walking slowly but totally on his own without the walker. And it's a big achievement for him, for this gentleman. And he's so grateful to homeopathy. So grateful. He refers many cases now to us and just very thankful. So another big win for homeopathy, or another big win for you and me, and another big thing for us. Baraita Mure is a huge remedy for me. Many cases, even in children's cases of adenoids, of sexual issues, Baraita Mure. But the main thing where I use Baraita Mure almost every day in my practice, I want to tell you, is in a condition I use almost every day. One case I get. What is the indication I want to show you? In Baraita Mure, they have a very peculiar blood pressure. Right? What is the peculiar blood pressure? That the systolic becomes very high. It may be 180 by 90 mmHg. What means? That means the systolic becomes very high, diastolic remains the same. Right? The systolic goes high and the diastolic remains almost the same. So you can read this from Boric. I'm going to make you now read Boric. Okay? Boric Materia Medica. I'm going to open Baraita. Let's have a look. Baraita Mure. Boric. Let's have a look at Boric Materia Medica. Let's have a look here. You can see here, first paragraph. It's written arteriosclerosis where high systolic pressure and comparatively low diastolic pressure is attended by cerebral and cardiac symptom. This is the main keynote. Okay, this I always confirm, and so many patients with cardiac problem you can help with Baraita Mure. So this is another very beautiful case of Baraita Mure. Coming back to our talk, well, we are going to talk about a lot of cases in our seminar. Women's hormonal health is going to be my main topic. Many cases of infertility, ovarian cysts, tumors, menopausal issues, sexual issues, many newer remedies like matrimonial, many animal remedies, many lac remedies. You're going to learn all the lac remedies also, a lot of insect remedies. Also, I'm going to talk about Schuessler tissue salts in detail, the repertory, many complex cases, many newer remedies, and Recife, October 2025. I really want to look forward to meet you, every one of you, uh, everyone who's watching this online. Some of you may be watching this later. You may be watching a recording, and Carlos will, of course, after this, share the details of this, how you can join online. Sometimes I know it's difficult to come in person, but if you can't come in person, join online, because we will be in touch, and I'm going to launch this book, which you will be getting on a special discount. Also, many newer remedies, close to 20 cases. So yes, I'm excited to meet every one of you. Also, because I'm going to come to Recife, I'm going to keep one day to see patients. And if anyone, we had appointments for only 6 or 8 patients. We already have 5 patients. We have 2 slots remaining. If any one of you want to refer a case or want an expert opinion, you're welcome. You can write to me, gaurang@gmail.com, or WhatsApp us. You have our WhatsApp number, and we will be happy to accommodate you. We have a slot for any 2 patients, which if you want to refer also you can. So this is the idea of the whole seminar, which well, we are very excited about. And Carlos, all over to you. We did 3 cases, 3 totally different kind of remedies, 3 different approach. As you already know, Carlos, you're so senior, so experienced, and such an open person. Every case requires different approach, and that's what we'll be doing in Recife.
Yes. This is that. This is what I love to bring so deep understanding when we come here for a lecture with a master like you, to Sankaran,
Or
Dr. Jayesh. It's wonderful that every master have his concept but always very deep, not superficial, never superficial.
Yes.
You always need to go deep into the cases and okay, I will speak to my colleagues in Portuguese to invite
Sure.
and to
Sure.
promotions. May we do some promotions? Do you allow us?
Yes, of course. Of
Of
course, yes.
course. Então, pessoal, é um orgulho imenso, é um prazer imenso. A The Other Song convida vocês para esse seminário que a gente vai ter agora nos dias 17, 18 e 19 de outubro em Recife, Pernambuco. Eu vou compartilhar com vocês aqui a tela e fazer uma promoção a respeito
So Carlos,
desse
so Carlos is
evento,
doing
porque
the
então, Recife,
Sure.
dias 17,
show
18 e 19,
and
o evento é
making a
presencial. Eu
special prize, I think,
claro
today.
que estar
Let's
ao
see.
vivo é sempre um prazer, né? Nós estaremos numa praia maravilhosa, praia de Boa Viagem, pé na areia, o hotel é pé na areia,
He's telling a bit
a
about
gente também está recebendo outro hotel que fica a 300 metros
where the
distante,
seminar is, where it's just by the beach and
aqueles
it's
que
very
quiserem
nice venue.
presencialmente, é sempre um prazer, talvez até consultar-se com o Dr. Gaurang e ter essa possibilidade, porque quem está lá sempre tem a prioridade de conversar, de fazer suas perguntas.
So he's saying that
Claro
everyone
que
that is
onde
on
houver
person is
momento
much easier to
acesso,
make
fazer suas
questions and
perguntas, e às vezes
to be
Sure.
there and to
obviamente,
greet
a
really.
condição que
And
isso possa acontecer. Então, por isso a gente
sometimes
está
it's not
tentando um
possible
evento híbrido.
for everyone.
O
So
objetivo da
that's
Deus
why we
é
have this option of online
encontrar
for
esse mestre uma vez
everyone
mais.
that
A gente
cannot
vai
be
trazendo ele de
there in
novo,
person,
de
and
novo. Nós temos
we will
você
bring him.
há 15 anos já trabalhando com ele, Dr. Gaurang,
Dr. Shankar is coming for 15 years, and Dr. Jayesh also. Gaurang is coming with us for
Então, a gente sempre
several years right now,
não
and
precisa ser um grande homeopata clássico inicialmente.
we always say that a homeopath should first be a classical homeopath, so that's why we bring classical approaches and
das matérias médicas, saber os
contemporary
remédios
approaches
que
also.
precisa usar e por que usar aqueles remédios, né? Então, quando a gente vê um caso como esse que a gente viu, a varita muriática, esse caso de calcária fluórica,
So when we see a case like this, or that of
como usar, não é
calcária
uma
fluoric or
ideia
baryta maior
conceitual de
linked to
autor,
how to use it, it's not just one idea of one author, but
como os mestres
it's a gathering of different masters
Shankara. Então,
that comes from his study with different masters like Dr. Shankar and Dr. Sharkar.
presencialmente. Depois do Covid, parece que ficou mais
So it's
difícil.
very, it seems that after COVID, it's harder for us to gather and to be together, but we really want to bring everyone. So for people who are enrolling now, would have a new price, but to anyone in right now can go to the prior price. So will be 3 days of knowledge, case after case, and we'll see the Schuessler thoughts, the book on Schuessler thoughts.
Trazer para aqueles que quiserem enviar, entregar autografado no local do evento.
So people can take an autograph and a signed book by Dr. Gaurang, and we will also post for anyone that want to have it.
Esse conhecimento que é difícil de obter dos livros. Eu digo que eu procurando estudar o site.
It is a knowledge that it's difficult for you to gather from different books.
Muitas dúvidas, você não tem o Dr. Schuessler lá para te responder. Então, é o teu momento de conhecer e aprender mais sobre
it will be the right time for everyone to learn more about these tools and also these matrimonial remedies in very pathological cases. So it really seems that Dr. Gaurang sees lots of deep pathological cases, cancer and autoimmune and other things. So it seems that his soul calls for these difficult cases and he brings these cures, and we all love to see it.
Eu nunca vi
So
outra coisa.
I never saw Dr. Gaurang use the same case twice, and it's very, very amazing.
É sempre um caso novo.
And I have been following him for years, and so
Impressionante.
the number of cases that he has is really amazing, and to be there in Recife would be an opportunity for everyone.
Para um evento presencial, manter esses valores é cada vez mais difícil. Então, aproveitem. Faz 2 anos e meio que a gente trouxe agora a última vez, e agora é uma nova oportunidade de estarmos presencialmente ou online. Online vai ficar. Para aqueles que estiverem presencialmente.
So there have been 2.5 years from your last visit, and
Porque às vezes a gente, numa vez só, a gente não
but
tem
for everyone that cannot join, you could
que estiverem
be online.
também vão poder ficar por 6 meses assistindo. Valor 2.100 até amanhã. Se você não conseguir fazer hoje, até amanhã, 2.100. Depois é 2.300.
He will keep the price till tomorrow for everyone that
também com essa
enroll until tomorrow.
Veja lá, faça já sua matrícula, sua inscrição e inscreva-se, aproveite. Eu acho que é isso. Temos uma pergunta aqui. Agora que a gente tem uma. We have a question. Let me
Sure.
find the question.
Okay.
Okay. Aqui, ó. Então, lá em cima, só um pouquinho. Deixa eu. Daí você traduz para ele lá, né, Marcelo? No caso de pressão arterial sistólica alta e diastólica baixa.
When you have this high systolic pressure and low diastolic pressure, is Barite also indicated? I think
Say again.
I think that's just what you saw. You told us. She's asking if in a hypertension case with high systolic blood pressure and low diastolic blood pressure, if it's indication for Barite.
I will just try to correct the explanation. See, normally systolic goes high, diastolic also goes high, like 180 by 120, for example. What happens in Baraita Mure is that the systolic goes high, let's say 180, but the diastolic doesn't go as high. So it will remain comparatively lower if you see. So in short, the gap between the systolic and diastolic is much longer in remedy like Baraita Mure. If I can explain you a little bit more better.
A Raquel também pergunta se pode ser adquirido o livro.
Raquel is asking about the book, if we will post the book for everyone, and then Carlos is saying that yes, we will have the book and we will post the book for anyone that wants to have the physical book, and we will send for everyone.
Yes. But very important is that they will be able to use the understanding of the book better if they attend the seminar, because if you just read the book, it's okay. Of course, you're welcome, no problem. But if you know the art of using it, then you will be able to understand it at much better level. It's like an instrument, If you have a guitar, okay, you can buy the guitar. But if you learn the art of using guitar and buy the guitar, then no one can stop you. So it's something like that. So if you do get a chance, I very humbly request and encourage you that come and we will study together, and it will be a pleasure to meet each and every one of you.
E nós, pela pergunta aqui da Raquel, aqueles que estiverem no seminário online, claro que presencialmente, obviamente, mas no seminário online, e pedirem o livro, a gente vai enviar autografado.
So Carlos is saying that everyone that is there will get a signed book. And for people attending the seminar, also we will post a signed copy, right?
Yes. I think Adele Jizar asked about some consultation. For consultation detail, we have only 2 appointments available. You just have to
perguntou alguma coisa de consulta, ele
just
acha.
have to email us on this email ID,
A
or you
pessoa
can
tem que mandar um
WhatsApp us.
e-mail para ter o horário.
Marcelo, pode traduzir? Ele estava falando que... ele falou que só tem mais 2 vagas para consulta no local, né? Então é para mandar e-mail para ver a questão do desconto. Valores 2.100, 2.300 hoje, eu coloquei ali, né? Mas nós estamos fazendo a promoção hoje e amanhã, 2.100 o valor do seminário, tá? O valor da consulta eu não sei, aí teria que ser por e-mail mesmo. Aqui o Gustavo pergunta quais seriam medicações para hipotensão
So
postural.
Gustavo is asking if you have an
180,
indication
80 deitado, ou
for
seja, quando o
a
paciente levanta,
postural
hipertensão,
hypotension. When
hipertension,
the person is lying down, it has hypertension, and when he stand up, has hypotension. Is a patient with Parkinson's disease, so they are thinking about some dysautonomy issue. In this case, if you have an indication for that.
Study 3 remedies. Of course, I won't be telling you one remedy. You have to study them. One of them is conium. You want to study them because it has symptoms like postural hypertension. You want to study cocculus. You want to study belladonna. All these three has very peculiar postural hypertension related symptom. And finally, also study a bowel nosode. It's called as bacillus number 7. I will encourage you to study all these remedies in detail and study all the modalities in detail, and after that prescribe.
Gaurang, we have a question here. If the book is going to be available in Portuguese also.
At this,
Translating?
I don't know. Katarina is here, but you won't believe. We are just going on printing today, and I'm just hoping that we get enough books to take it to Brazil, or else I'm going to bring some books in the bag with me. So it's going to be crazy. So first we will try to get the English one. Let us see how it goes, and maybe in future. But I, at this moment, can't really promise something that.
Okay, but the question is it will be available in Portuguese or only in English?
English. We have it in English. I just wrote the book about 3 months back when we decided to have this open session. You remember, in this book, I have written in an introduction that this book is thanks to Brazilian colleagues, because this book we are launching for Brazilian people. Also, there is a story behind writing this book, that me and Katarina were traveling in Paris by train, and I wanted to study tissue salt, but I couldn't find a good book to study. And that's when I thought I should write a book so that everyone can study. This is actually the story of the book. It's with a lot of love that I've written, of course, because it was me and Katarina traveling in the train with no book to study. So it's like this. It's the beginning genesis of the book is like this. Yeah.
Yeah, amazing. Yeah, I mean, if Katarina could translate your book, I can print this in Brazil also. If later.
Yes, but I don't think we have the time or the energy to do it right now, Carlos. It's really crazy, really crazy. But of course, in future, whenever we get a time, it's possible, because me and Katarina also, we are here developing the clinic, the house, life, Carlos. But at some point, yes. At some point, yes. At this moment, I can't promise though.
Yeah, yes. And let's try. I will change here for right. Yeah. Okay. So let's see if somebody also could translate later. If you
Yes,
will
awesome.
agree.
Yeah, it's possible. We can definitely think about it. Why not? If there is someone, we'll definitely give a thought. But it's really amazing. This tissue salts, I really want that our friends in Brazil use it, and we can really help so many more people. It is not an alternative to homeopathy at all. Homeopathy, classical homeopathy is as it is. The tissue salt is just an additional kind of thing that can help sometimes in certain cases, not in all cases. So yeah, I am very excited, and of course excited to go to Recife. Has very beautiful beaches, has amazing food there. I met Katarina and her family there. Katarina will tell you how beautiful Recife is.
Catarina está aqui com a gente agora, né?
Tava
Aí,
tentando.
olá, Catarina. Bom
Bom
dia.
dia, todo mundo.
Estaremos.
Só retificando a questão das consultas, são 3 turnos e agora só temos 2 turnos, não são só 2 vagas, tá? Então, o pessoal só mandar realmente o e-mail que a gente vai estar passando os detalhes.
Que dia que vai ser as consultas, Catarina?
Vai ser em novembro. Aí a gente vai mandar detalhe de valores e datas, mas vai ser em novembro. O seminário vai ser em outubro, mas as consultas acontecerão em novembro, isso.
no caso, presencial ou online?
Presencial.
Presencial.
Em novembro,
Aí-
a gente colocou essa opção, por a gente vai estar no Brasil, então a gente vai atender presencial. Claro que quem não conseguir presencial, a gente vai realizar as consultas online.
E aí, em Recife mesmo, né?
Em Recife, isso. Uhum.
Olha, perfeito, muito bom. Aí o e-mail tá ali, né? Qualquer dúvida, envie o e-mail pro Gaurang. A gente, né, não é nossa parte, né? Mas a gente pode também redirecionar, se for o caso, mas pode enviar diretamente para o Gaurang. Foi colocado,
Isso.
né?
Já, eu coloquei uma foto, tem um template, a Cris já baixou, ela vai estar compartilhando e é só enviar o e-mail.
Joia, perfeito. Muito bom, muito bom. Thank you, my friend. Pessoal, fiquem aí um pouquinho antes de me despedir do Gaurang. A gente vai ter uma apresentação agora que convido todos vocês a
So
ficarem.
Carlos is inviting everyone to be with us. We will have this presentation on
de ter a
on
oportunidade
the Viva
de
software right
da
now.
Other Song, não só trazer os mestres, mas trazer as ferramentas, né? As ferramentas.
So we bring the masters and we bring the tools,
o conhecimento, mas não tem a
or
ferramenta.
try to bring the tools for everyone,
Fica
because
mais limitado, a coisa fica mais restrita.
it can
né?
be very
Ter as
limited
ferramentas na mão,
if you don't have the right tools to
ter
Do
use
you think
like
there is
this
a chance,
book
Master,
that,
you're coming? Maybe difficult.
well, it didn't seem so. It seems that in the planning it was not possible for us.
Então,
Okay, no problem.
So I was speaking to them about how important it is to be good in tools and to have good
Yes,
tools, like
totally.
a good repertory and know how to use.
Absolutely, absolutely. Repertory, even reference works, and all different types of repertory. Like for example, when I come to Brazil, I will show you how I use Hitherley's lac repertory. Patricia Hitherley has a
Yeah,
mammal. I use it a lot to choose the correct mammal remedy. So I can find remedies like lac leolinum, even lac ovis. You're going to see a lot of different lac remedies, lac ovis, lac caprinum. How to use it through repertory, because you will not get it in complete repertory easily. It's very important to innovate and know all these newer ideas. This is of course for advanced homeopaths, but for people who are in the first 5-10 years of understanding homeopathy, you want to start with basic Kent, Fatak, Boger, all this, and then go to the next level. So
That is a wonderful repertory. I use a lot of.
yeah, it's a beautiful one.
Yeah. So thank you again, my brother.
Thank you, everyone. Obrigado.
I'm really anxious to hug
I am
you in
excited.
person
I am
again.
excited to meet every one of you. I will see you
Yeah.
all. Thank you.
And so now, and thank you, especially because your generosity to spread your ideas, to share
Sure.
your ideas, like this in sessions, in open sessions like this. You
Of
are
course.
the best. Thank you so
We
much.
should, Carlos, every year we should do at least one free session for each and every homeopath in Brazil, because that's only way by which people who cannot come, people who cannot afford, or people who are in different parts of their life, they can be up to date with what's happening, and they get a chance to think about how they can probably do something together. So we should do once a year something free. I'm sure you already.
We used to do this every month. Every month we do
Wow.
open sessions because this is.
I think every month becomes too much, but once a year you should do.
I mean, in the Other Song Brazil,
Other Song Brasil, yeah.
we used to do every month in TOS Brazil. We used to do one open session with
Understood.
one master, or we
Sure,
normally
sure.
do this because it's like a retribution to.
Yeah, we have to give back. We have to give back to our people, and just so good to connect to all of you on a Sunday. I'm so happy. I
Thank
feel
you,
as if
Gaurang.
one part of you are with me. Thank you. Obrigado.
Thank you. See you. Thank you.
See you all in Recife.